I think that is really paying a tribute to Dr. Ruben Mesa, who's done the most in patient-reported outcome in myelofibrosis and MPNs in general ever since the first questionnaire started, actually around the era when the JAK mutation was invented as a major drivers. We definitely need to focus better patient-reported outcomes to be implemented in the clinical trials, because even JAK inhibitors were, the first JAK inhibitor approved, were approved based on improvements on symptoms on spleen. So that is really a point that was made even by the FDA. This is really relevant in the field. We have not had any agents changing the survival yet, but we really need to engage the patients community and get in patient survival outcome. There are very well defined and established questionnaires that exist in the field. They just have to be implemented more frequently. The major thing is to do them repeatedly and basically guide the treatment decision and change in treatments, which is going to be even more important with the suboptimal add-on regimens, where none of us actually agreed upon and has a defined criteria at which point the patient is failing and is actually suboptimal. Is it based on 1 point worsen on the symptoms, or is it based on 1 point worsen of anemia? They all, I think, are basically paired together. We just have to pay attention to that. So definitely very important endpoint that should be implemented in patients' endpoints, in a patient's focus, as well as on clinical trials in patients with myeloproliferative neoplasms.